Hello, this is Dr. Joseph Arevalo, and I wanted to give you an overview of what conditions arise after you have a motor vehicle accident. We're going to go from the top to the bottom. All right. One thing that you can create or you can get from a car accident is mild traumatic brain injury. That's caused by the rapid movement of the brain inside the skull from front to back or from side to side, and you can have all different kinds of neurological complaints. Forgetfulness, you're not cognitive, you have a fuzziness in your brain, you're not comprehending things, you're just not getting it, and that's caused by the accident. You can also have your cranial nerves that are right here where the brain meets the spinal cord, and these nerves are very important for many autonomic, or what we call autonomic, which means automatic functions, or also other functions that you use, such as shrugging your shoulder or moving your eyes around, moving your tongue. Few people who have car accidents, they develop a loss of the sense of taste, so they don't really enjoy their food anymore because the nerves get stretched by the rapid movement inside the brain, inside the spine. It gets moved around so much. Or visual problems, because once again the nerves are attached here, and they're also attached on certain parts of the body, so they get stretched, they get inflamed. The next thing we have here, we can get dizziness. That can be caused by a rotation of this vertebra, or also just movement inside the brain or the back of the brain, which is called the cerebellum, or also there's stretching inside the spinal cord, and these are called spinal tracts. And you can also have some dizziness by the joints and the spine being hypermobile or moving too much. You also can develop neck pain. That's very obvious. If you have a car accident, you have this rapid movement front and back, and it stretches and tears the fine ligaments and tendons of the neck that support it. You can also compress the vertebrae, so you get headaches, and there's not enough blood flow going to the brain because there may be a rotation, or also because of the mild traumatic brain injury that you have, or because you have muscles that are referring pain back to the head that are called cervicogenic, which means that it's caused or it's originating from the neck to the head. The next thing you can have as well is low back pain. I'm sorry, thoracic outlet. Thoracic outlet is the area between the shoulder and the neck, where there's a large amount of blood vessels, veins, arteries, lymph nodes, and nervous tissues, and muscles and tendons and bones that are within this small area. So if there is any abrupt movement, either compressive or stretching type action, you can cause that physiology to be disrupted. You stretch that nerve, the nerve starts to get inflamed, and it can't transmit the information like it's supposed to. Or the blood vessel gets pulled, you can develop some swelling because there's micro tears inside the artery. So those are some things that you need to be very aware of. Whenever you have this thoracic outlet, you'll develop a heavy hand, pain, tingling, numbness, loss of function. You can't grab onto things like you were supposed to before, or you used to before. And another thing that you get as well is low back pain from the rapid movement and hyper mobility of the spine. It's not normal for your spine to go within a certain amount of movement, and when it does that, you start to stretch and tear the tendons and the ligaments, and sometimes small blood vessels within the back and in the spine. And all this compressive action puts pressure in the spine, on the disc, and it can bulge out and start busting out over here and compress or push up against the nerve. Or sometimes the chemicals around the disc, it starts to release itself almost like poison ivy touching the skin, and it touches the nerve and it causes it to be inflamed. So chiropractic treatment is a preferred method if you've been in a car accident, because chiropractic addresses all of these conditions. Chiropractic treatment is the hands-on treatment of manipulating the spine in the normal positions and to realign the spine back where they're supposed to be. It's very difficult for a medication to correct that problem, and it's definitely surgery is definitely not an option if you've been in a motor vehicle accident, unless it's a very life-threatening situation or you have a condition that just that has lasted for too long, and you've already received chiropractic or conservative treatment, that's when surgery or epidural injections become an option. But chiropractic treatment is a preferred method because it doesn't cause as much side effects, or it doesn't cause hardly any side effects as opposed to medications, and it's a lot simpler and easier for your body to respond to. Your body wants to be in normal alignment. It wants to be repositioned the way it's supposed to. Your body may need to have some medications to decrease the inflammation, but it's not a solution to fix the problem. That's why I recommend that you do get evaluated by a chiropractor to evaluate these conditions, to evaluate these problems, to detect what spinal vertebrae are misaligned so you can correct them. So that's my input for you. If you have been in a car accident, or maybe you know somebody who's been in a car accident and they just don't want to get treatment because they don't want to go to the doctor or they don't want to get therapy, that's something. They're just hurting themselves. They're not allowing their body to get the maximum out of yourself. You're not allowing your body to live the way it's supposed to, which is supposed to be pain-free and actually being feeling well and feeling great. That's what your body is meant to do. So if you've been in a car accident, give me a phone call. My number is 956-661-0092. I'm in McAllen, Texas. If you've been in a car accident, you live in Mission, if you live in Pharr, if you live in San Juan, if you live in Hidalgo, Edinburgh, anywhere in the Rio Grande Valley area, give me a phone call. I also have a toll-free number. It's 866-945-7266. Give me a call.